Welcome and thank you for joining us for our COVID-19 and vaccination community forum. We're very happy to be able to provide you with an update on COVID-19 and what's happening in our community. A big part of the presentation today will be focused on vaccinations, since that's the biggest COVID topic that we're addressing right now, and all of our focus is really on rolling out vaccinations. So we'll start with a brief overview of what's happening with COVID in our area, and then we'll move into vaccination. There is a chat feature here, so if you have questions as we're going through the presentation, feel free to type those into the chat. And at the end of the presentation, we'll go through those questions and answer those for you. So I'm going to turn it over to Dr. Duffy right now, and he will start the rest of the presentation.
Thank you, Koren. Good afternoon, everyone. Well, let's start by taking a look at where we are with COVID-19 present state. As you can see, this is a nice map of all the counties in the United States. Red is bad. Actually, magenta, which is the really deep red, or the maroon, is very bad. And you can see Michigan is having a terrible time of it, as is the panhandle of Texas. Red is also very bad, but it gets less bad as you go to orange, yellow, and green is the best. Green is, New Hampshire was green for quite a while, in Vermont, but recently not so much. So you can see the Northeast is doing not so well comparatively by how we've done up to now in the entire pandemic. We've actually done very well up here in this corner of the country, but now we're just like everybody else, with the exception of the really bad actors. Here's New Hampshire. You see Grafton County is the big red county on the left in the upper. Coas is actually doing a little bit better than the rest of the state. Most of the populated counties of the state are red. Here's Vermont. Chittenden County is the big county all the way to the left. Grand Isles above that probably just gets spillover from Chittenden. And you can see some Northeast Kingdom counties are not doing so well. So in New Hampshire, cases, this is the amount of cases, this graph, per 100,000 people. So this is new coronavirus diagnoses. And you can see, let's just focus on the orange line. That's the state of New Hampshire. And you can see early in the spring, we had quite a bump. And it flattened out over the summer and then picked up around Thanksgiving. And there's the famous post-Thanksgiving bump there that you see, the first kind of sawtooth all the way to the left of the big mountain. And we've kind of been very high, coming down slowly into March. But as you can see, we've now had a increase. Most accounts are that this increase is due to the highly infectious B.1.1 strain, so one of the variant strains, so-called B.1.1. It was also formerly called the UK strain. It pretty much makes up most of the new cases, and that it's very infective. It's easy to catch, easier than COVID. COVID was very easy to catch, and now this new strain is much easier to catch. It's not more severe when you get it, person per person, but it's more severe. And this is why we're having an outbreak at this time. We'll go through infection rate, G1.19. Anything over a 0.9 is not good. That means that for every person who gets infected, they can give it to more than one person. Positive test rate has taken a bump. You see over the summer, we really had very low incidence. And this rise you can see is due to variants. Current hospitalizations, you can see now it's starting to go up again. We did have a very, very trying period in January and February, January, mostly January, where really we reached almost capacity here in the state, and it was looking very sketchy and dicey for us for a while. Seems it has improved significantly, but there's a little bit of an uptick recently. Now, the reason why the uptick in hospitalizations does not mirror the uptick in new cases is the thought is that younger people are getting infected and they don't need to be hospitalized as much. You see the same thing even more so in the deaths. There's really been no spike in deaths because the young people tend not to have mortality from this disease by and large, although young people do die of it. You can see the summer, we really had a few days where there were no deaths in New Hampshire, which was quite nice. So let's just the regional summary here for us. Northern Grafton, Southern Coos, very high levels of transmission and disease development continue from the end of 2020 and the high number of cases in young people, and it is still at historically high levels. We're in phase 1 at LRH of our operations plan, meaning we have less than 5 admitted patients here. We've never had more than 5 admitted patients throughout the entire pandemic. We do have a COVID unit that's completely isolated from the rest of the hospital and is extremely safe, not only for the COVID patients, but for people who come to the hospital for non-COVID related issues. We've tested more than 15,000 patients and community members since May, mostly community members by far. Our positive test results are whopping greater than 11 and a half as of last week. Most of the pandemic, it was floating around 4 or 5%. We believe that a lot of this is from individuals coming across from Vermont as they're having quite an outbreak in Caledonia County. Grafton County, we're taking our licks as well. And there's a lot of outbreaks here in Littleton of incumbent New Hampshire or Granite Staters, but much more so in Vermont. We've done well over 10,000 vaccinations administered to the community and our workforce since just pretty much the end of January. We're continuing to do vaccines. We're doing 200 a day approximately. Koren, you want to say a word about that?
Yeah. So we are offering a community clinic. We started out with 3 days a week at the end of January, and quickly within 2 weeks actually increased our clinic to 5 days a week. And we've been offering vaccines Monday through Friday from 8 to 4 since then, with a pretty significant increase in the volume through our clinics in the last 3 weeks as our allocation from the state increased. So most every day of the week, we have 196 appointment slots that are open for community members. And we've really, we had several days where we were at max capacity over the last 3 weeks. This week is a little bit lighter. So if you have an appointment for a first dose later on, there are plenty of open appointments this week if you would like to move your appointment up to get your vaccine sooner.
So let's take a look at vaccines in general. We all recognize that vaccination is one of the major success stories of modern medicine. There's an old story that plumbers have done more for public health and for people's health and happy livelihoods than physicians ever did, because of the fact that plumbers made plumbing and there wasn't a lot of infectious disease around. Vaccines have actually added to that in the early 20th century. And we all recognize the incidence of infectious diseases has decreased, such as measles, and we've eradicated actually smallpox and many diseases. Nobody really has polio anymore. When I was a little child, it was a scourge. It was quite a big deal. And now we don't have any of that, and that's because of vaccines. But what do vaccines do? Well, there are certain cells of the immune system that produce antibodies, which are actually proteins, that actually these proteins can recognize things that cause disease and actually attach to them and inactivate them. Conventional vaccine approaches utilize this and have really not been that effective against rapidly evolving pathogens like influenza, right? Every year the influenza vaccine is different. The SARS-CoV-2 vaccine, SARS-CoV-2 virus, which is the thing that causes coronavirus or COVID-19, does not evolve that much. Now we're talking a lot about variants, but it's nothing compared with what influenza does. And also conventional vaccine approaches are not so great against emerging disease threats that happen suddenly, like Ebola or Zika viruses. Well, that was up until now, because unfortunately, the people at the National Institute, this is at the US National Institutes of Allergies and Infectious Diseases, which has been run by a man by the name of Anthony Fauci for the last 20 years. Back in 2003, when the SARS-CoV-1 outbreak hit, which you may all remember, they said to themselves, you know, we better look for a vaccine to the SARS virus. There's going to be other SARS come along, so let's start working. So in 2003, they started working on it, and thankfully they did. So because of that, and because of some increases in technology or advances in technology, we now have vaccines available to treat SARS-CoV-2 or COVID-19. And as I stated, the research started over 15 years ago, and we now have two types of vaccine available in the world. One uses what's called an mRNA vector, so you just got to go with it rather than get into the science of what that all means. It's actually a strip of code, not DNA, it's not your genes, it's just a strip of code, almost like a cassette deck or a piece of tape on a recording tape. And then we also use the mRNA for these new vaccines, and we also use a so-called traditional viral vector, where they take a feeble, inactivated, or actually not even a real virus, and use that to deliver the message into the body to create the antibodies. So all the three vaccines that are available that have been authorized in the United States are authorized under an emergency use authorization. We've had some of these before. Some of the influenza vaccines were EUA'd, and other medications in the past were EUA'd, so-called EUA, emergency use authorization. So this is not new. The FDA did this in this case because they needed to move rapidly, expeditiously, but rapidly. But to get an emergency use authorization, they needed to get approval from the National Academy of Sciences, Engineering, and Medicine, the Vaccines and Related Biological Products Advisory Committee, the so-called VRBPAC. They're really the big players, and the Advisory Committee on Immunization Practices, ACIP, which is actually quite active day in and day out, evaluating vaccine use, dosages, and appropriate usages. One of the reasons why an EUA was needed to be used is because the rules behind actually clearing or approving a medication would not have allowed it. They actually have built into the law and the statute and the regulation that you have to wait so long, even if you know it's going to be okay. So that's why an EUA is used. Let's just talk about vaccines for a minute. The general principles for public health on vaccines: you decrease the individual risk, but you also create a herd immunity. So in the population, everybody's immune. So even if people who are not vaccinated, for people who are not vaccinated, they won't get the disease because the disease can't thrive. It can't live off of anything. So it doesn't exist. This has worked for measles and polio, except for in rare instances where communities, for some reason or another, people don't want to get vaccinated anymore. They stop getting vaccinated for measles, and lo and behold, people start getting measles. So herd immunity is that halo effect that the entire population gets from having a critical number of individuals in the population vaccinated. This number for COVID, we thought it was around 70%. It does depend on how easily infectious the disease is. And with the new variants, they're much more easily infectious, so the number's gone up. The other general principle for these vaccines, because they're under an EUA, is they're not considered to be mandatory, at least for healthcare workers or people in certain professions, or in fact, to go to school or to do any other thing. So that's the general principle for vaccinations. The rationale for individual vaccination is, look, it effectively reduces the risk of morbidity, disease, getting sick, and death. In fact, these RNA vaccines especially have 100% protection against morbidity and death. Also, individually, you're less likely to spread to non-immunized friends and family. We now know this to be true. We can't quite say it's 100%, but it's quite high. And hey, when you get vaccinated, you can return to pre-COVID activities. You can safely. Here are the vaccines, basically the Moderna and Pfizer, the well-known ones at this point to us are mRNA vaccines, 2 doses, a variable distance between the 2 doses, full effect in 2 weeks, very effective. Moderna, for instance, is effective in Pfizer, 94 and 95% effective against any disease, getting the sniffles. But you can see Moderna is 100% effective against severe disease. So that actually means hospitalization and death. That's why there's a not applicable there. Pfizer, a little bit less, but actually we've seen in the over almost 200 million doses in the United States that it's been 100% effective also against disease, hospitalization and death. That's what you want. These 2 vaccines, so you can see they're not 100% effective. There's going to be breakthrough infections, but it effectively reduces the let's call it COVID-19, into the common cold. And you can see the side effects. Most all have pain at the injection site, just kind of like the tetanus shot has pain at the injection site all the time, but other ones don't. Like if you get the flu shot, you don't get it all the time necessarily. You get tenderness in the vaccination arm, you can get fatigue, headache, muscle pain, and it's actually quite high for these, relatively speaking. About 20% of people will get some redness in their arm, which is really quite high, but these are minor and they go away in a few days. And with some Tylenol, you tend to do very well and feel well. There's a couple of delayed responses where you can get a red arm up to 2 weeks later. It's kind of rare, but it's again insignificant. Take some Tylenol, you do better. Johnson & Johnson vaccines, that's actually the Jansen vaccine, that's one of their brand names, has pretty much the same side effect profile. For any disease, it's 72% effective, and you can see it's 100% effective against hospitalizations and death. Okay, let's just talk about the mRNA vaccines for a minute. These are the Pfizer Moderna vaccines. They work by introducing this mRNA sequence. We talked about it a minute ago. It's kind of a piece of recording tape, that kind of thing that goes into your body, and it tells your cells what to build. And so when this is injected into you, it'll tell your cells to start making antibodies. Oh, actually, it makes the antigen that makes it look like the vaccine. It actually is just a piece of the vaccine. And then your antibodies will be made by your immune system. They'll see that foreign protein, which is harmless, and make antibodies for it. By the way, your immune system is very robust. It has a lot of time on its hands, and it works relatively rapidly. So it takes 2 weeks in all 3 vaccines, frankly, for you to get up to speed. So you need to know there's a lot of, because it's got mRNA, RNA versus DNA, people tend to think, uh-oh, it's like a gene. No, the mRNA does not integrate itself into your genes, into your host genome. And actually the mRNA strand in the vaccine is destroyed once the protein is made. Once that piece of tape is put in the tape machine, it gets destroyed. And that's taken up rather quickly, as I tried to describe. When you eat food, you have mRNA strands from the food in it, and you get that gets into your bloodstream. I like to say when you eat a banana, you get mRNA of a banana in it, but you don't turn into a banana. You're not going to turn into this mRNA or a COVID virus. It's not going to go into your genome. So the advantages of mRNA vaccines, this is what was wonderful about them. They're really fast and cheap to produce. You can actually produce them on a computer, and they create the product quite easily. Don't ask me how that works, but you can do it. The mRNA vaccines are also highly effective. We can see the difference. The Johnson & Johnson Jansen vaccine is the traditional viral vector type. It's about 3/4 of the people it's effective against any disease. You can see that the Pfizer and Moderna mRNA vaccines are 95% effective. These mRNA vaccines are actually also safer, way safer actually. They're not produced using infectious elements. There's nothing in there other than this little strand of mRNA that, remember, you can't turn into. It has no organic contaminants in it whatsoever. So it has no additives, no contaminants, no special proteins. It does have a thing called polyethylene glycol, which sounds terrible, but that's actually the thing that's in laxative. It's in the laxative you take when you're going to have a colonoscopy. So polyethylene glycol, and it's called Miralax when you buy it in that form. And you drink it and it stays right in your bowels. It doesn't, you don't absorb it. But some people, but you can absorb it, right? If it's injected into you. And it's a very, very tiny amount. It has an allergic potential. 1 in 1 million people can be allergic to it. And what happens is you immediately have an allergic reaction. And there's been no deaths from this allergic reaction. This is one of the reasons why we keep you 15 minutes after you get the vaccine. If after 15 minutes you don't have the reaction, you will not get the reaction. Redness in the arm a day later or 2 weeks later is not an allergic reaction. And it is not this allergic potential from the polyethylene glycol. Here's an original article from the New England Journal of Medicine. This stuff is well vetted, well talked about in science. There were 2 trials, of course, to do Pfizer and Moderna. You can see 43 and 30,000 participants. But I can tell you that the experience of over 200 million doses confirmed the initial studies on safety and effectiveness. You can see Pfizer was done internationally, racially and ethnically diverse, both of them, all different ages. Pfizer did over 16, Moderna did over 18. The reason why those are picked was just basically random. There's no science to say that one can get this. One should be 16 and one could be 18. The scientists at Moderna just picked 18. The scientists at Pfizer picked 16. And they picked those ages because they want to be through childhood. Okay, viral vector vaccines. This has become important today. They use a virus that does not cause disease as the messenger, right? To stimulate the immune response against the targeted pathogen, so against the virus that you want to keep from getting. Again, the mRNA vaccines don't use that. They just use the mRNA strand as the vector. Many of our traditional vaccines use this method, measles vaccine, et cetera. They often use what's called an adenovirus, which is the cold virus, but they mess it up by doing some things to it where it can't cause disease. They do induce a robust immune response. You can see 75% is quite good. It has been well studied by scientists over the years. We know how to do this very well. And they're easy to design and produce on a mass scale. We've been doing it for decades with viral vector vaccines. But again, they take longer to produce. And that's why the mRNA vaccines, Pfizer and Moderna, beat the J&J product to the market. A viral vector is used to shuttle the gene into the cell, and they code the spike protein, and then the spike protein is made by your own cells, and your immune system sees it and creates antibodies. Genetic material integrated into the vector does not integrate into your DNA. You didn't become measles when you got the measles. But let's talk a little bit about the EUA for the viral vector vaccine here in this country, the Jansen product, which is commonly known as the J&J product here. You can see they did about 40,000 international sites, US sites, age group 18. And since it's been given an emergency use authorization in the United States, we've delivered 6.8 million doses. Of the 6.8 million doses, there have been 6 cases, all in women under 50, where their platelet count, which is a thing in your blood that we naturally have that helps us from bleeding, drops low. It has to do with estrogen effect. Again, it's women under 50. Certain things happen to women under 50 when they become pregnant, the same thing. But anyway, there's been 6 cases in 6.8 million. That means it's less than 1 in a million incidents. So it's 0.00009% chance of it happening. And we also know that we don't know that it actually is caused by the vaccine. So 6 people who have been vaccinated have received this. People are being studied very carefully. There's been a lot of care and there's a lot of safety involved in all of these studies and in these post-vaccine analyses of individuals. So you can see they picked up on it very quickly that 6 people out of 6.8 had this condition. No one is saying that it's from the vaccine, but we're saying it's associated with the vaccine in these cases. I'll give you an example. Every individual in the world, every human who became addicted to heroin in the world was started on milk as a child. So that means that there's an association with milk use in childhood and heroin addiction. Now, we all know that there's no causal relationship. Drinking milk as a child does not make you a heroin addict. I'm just trying to highlight the difference between association only and causal relationship. We do not know if there's a causal relationship in these 6 cases out of almost 7 million that this low platelet count and the blood clots are caused by the vaccine. But the FDA paused giving the vaccine, paused the emergency use authorization to study the data, which we have. It needs to be studied. ACIT, we're talking about them a little bit earlier. They're meeting tomorrow to look at this. This is an example of the effective safety controls we have in the United States and how safe this process has been. I find it reassuring, frankly. If you've received the J&J vaccine recently and you're a woman under 50, what you should do, again, it's incredibly low. Go out and buy a lottery ticket because you got a better chance of winning the lottery. But anyway, you can win the lottery. Watch for severe headache, any neurologic symptoms like a stroke. That's what to watch for. If you have any worry about that, you can contact your primary care provider, or you can contact our COVID hotline at 575-6400. I haven't said it in so long, I almost forget it. We'd be more than happy to assist you. It's an incredibly rare event. Before I go and stop barking at you, I want to just talk a little bit about vaccine and pregnancy. There's a lot of vaccine hesitancy in women of childbearing age, relatively a lot, for a number of reasons. Let's just talk about it for a minute. There is no initial trial data on any effects, good or bad, in pregnancy, or the influence it would have on the ability to get pregnant. We would not have formal data on the specific effects of these vaccines on women of childbearing age, pregnant women, or especially the effects of their offspring for many years. It's just not going to happen. But based on past experience with other vaccines, there would be no reason to assume that it would not work in pregnancy, so that it would be effective. There's also no reason to suspect that this particular vaccine would cause harm or significant unwanted effects in pregnancy versus an individual who's not pregnant. As we discussed, there are advantages to these mRNA vaccines as they do not contain additives and will cause, in general, less unwanted reactions. Don't forget, the sore arm, the red arm is a wanted reaction. That's your immune system working. The actual agent that promotes the immune response does not cross the placenta into the fetus, so it doesn't get into the fetus. We know after hundreds of millions of doses worldwide, there is no evidence that the vaccine affects fertility either way. It doesn't make you more fertile or less. In fact, we anecdotally know people who have become pregnant who have had the vaccine. So on fertility, I think it's pretty much done. I cannot tell you with scientific certainty it's done because scientists and physicians as scientists are too cautious to tell you unless we see the studies. Now, reasons why getting immunized is really important if you were to become pregnant. It will prevent infection. That's important. It will prevent maternal complications. So the mother is 70%, we actually have there's a paper out in JAMA, was it JAMA? That came out and said it's 70% more severe when you're pregnant, COVID, to get it. as relates to hospitalizations, morbidity, and death. So you're more likely to die from COVID if you're pregnant. That doesn't say much for the outcome for the infant. There's also increases in things that happen to pregnant women during pregnancy if you're infected with COVID. And there's an increase in gestational diabetes, which affects the baby, and preeclampsia, which is a life-threatening occurrence that occurs in pregnant women. It also affects the baby. So it can also prevent potential fetal complications. Miscarriage and stillborn rates are higher in women who are pregnant and get COVID. It also protects your baby after birth. The antibodies you develop will pass through the placenta. Antibodies pass through the placenta. And if you're breastfeeding your breast milk, it'll help protect your baby from getting COVID-19 after birth. And it will protect your family. So with that, let's talk a little bit about vaccine logistics. I'll give Koren a chance to tell you all the great work that she and her crew have done.
Okay, so some vaccine logistics. As I mentioned earlier, we have been providing vaccines to the community since January 26th was actually our first clinic day. Our current phase, which you're probably all aware if you have seen any clip of the news in the last month, we are currently in phase 3. Phase 3 is all New Hampshire residents who are over the age of 16. Can you go back? We're eligible as of April 2nd. All individuals at this point must be New Hampshire residents and provide proof of residency at the time of coming for their vaccine. That is about to change. Governor Sununu announced last week that beginning Monday, April 19th, all individuals, regardless of what state is your primary residence, are able to register and receive a vaccine in the state of New Hampshire. Individuals must still show identification. So they need to show a picture photo ID that, proves you're who you say you are, and also proves your age so that we are able to verify that you're 16 years old or older to be able to receive the vaccine. Pfizer is the only vaccine that we have to be able to offer right now to 16 and 17-year-olds. We have a supply of Pfizer here every day of the week. We do our clinics Monday through Friday, and each day we have both Pfizer and Moderna vaccine available to us. If minors are coming, they must be accompanied by a parent or a legal guardian because we still need that parent to give consent for that minor to be able to receive the vaccine. So if you have a 16 or 17-year-old who you would like to be vaccinated, when you're scheduling their appointment, please keep in mind that a parent or legal guardian must accompany them, or unfortunately, we cannot vaccinate them when they present for their appointment. Our vaccine appointments are readily available as our allocation through the state has increased in the last month. So has the number of appointments. To give you, an idea of scale, probably 6 weeks ago, we had about 50 to 60 appointment slots each day. We now have 196 appointments available 5 days a week. All appointments, all people wishing to be vaccinated do need to register in VINI, which is the state website, which you can find at vaccines.nh.org. The registration process is really very easy. You enter your information and then you'll receive a confirmation email. And at that point in time, you are then able to log in, choose your site. It'll ask you to enter the zip code of where you live and show you clinics. I would recommend, because we are in a rural area, it defaults to a 10-mile radius. I would increase that because depending on where you live, it might limit you and say that there isn't anything within 10 miles of your residence. And then you're able to see all of the sites that offer vaccines in your area. You can click on the site and then select your day. You'll be able to see each day and time that's available for you. We are offering throughout at all state sites the +1 feature. So when you register, you can actually register for yourself and one other family member by entering their information, and both of you can come to that appointment. So you have one appointment, but 2 people are able to be vaccinated. Again, same rules apply, that +1 or the person that's coming with you must have a photo ID and be able to show, you know, at this point in time for this week that they are New Hampshire residents. If you do have an appointment later in the month or even out into May, I would encourage you to log into Vinny. We have plenty of first dose appointments available this week. So we would encourage anybody who's wanting to be vaccinated to log in and check that out. Our vaccine clinic is drive up. You will remain in your vehicle. You'll present your proof of ID to one person, and then you'll be screened. They'll ask you about allergies, if you've received any other vaccine within 14 days. Unfortunately, if you've received any other vaccine, you're not eligible to receive the COVID vaccine if it's been within 14 days. And they'll go through screening questions with you, and then you'll continue up our access road to the vaccinators. They'll vaccinate you in your vehicle, and then, as Dr. Duffy referenced, we require you to stay at least 15 minutes post-vaccination so that a registered nurse can monitor you for potential side effects. Typically, if you're going to have any sort of true allergic reaction, it will happen within that 15 minutes. As Dr. Duffy mentioned, you know, you will have some side effects, and that's to be expected. Those are not allergic reactions, but just side effects of the vaccine. Once your 15-minute observation period is up, you are good to go. And you will leave your first dose appointment with an appointment card for your second dose. So you don't need to log back in to make the appointment. You'll have that appointment made for you before you leave. So the process is really very easy. We've tried to really streamline the process and make it as efficient as possible for people who are receiving vaccinations. Okay. Okay, go to the next slide, which I think is just questions. So that completes our presentation, and we would like to open it up. I don't see any questions in the chat, but if you have questions and you would like to unmute yourself, you're welcome to do that, or you can type your questions into the chat box. We'll wait a couple of minutes to give people an opportunity to do that. If there does not end up being questions, then we'll wrap up the presentation. Yes. This will be recorded and posted on our Facebook page, our website, and I believe YouTube. If that's incorrect, Heather will correct me. But it is recorded so that if you know of people who are unable to attend today, today's not their only opportunity to see the information. All right, I'm not seeing any questions. So if you're watching this recording and you do have specific questions, we do have our COVID hotline that's available to you. The best time to call that is between 8 a.m. and 4 p.m. But it is manned 24 hours a day. And that number is 603-575-6400. We can answer any questions you have related to general COVID testing and vaccinations. All right, thank you very much. Not seeing any questions. We're going to end the presentation. Thank you for joining us.